With that sobering news, I want to bring in our expert panel, California Congressman Ted Lieu, Michael Osterholm, Director of the Center for Infectious Disease Research and Policy at the University of Minnesota, Dr. Leana Wen, emergency physician and public health professional at George Washington University, and with a look at how all of this is playing out both in the government and the politics, Michael Steele, a former lieutenant governor and former RNC chair. Great experts. I could start anywhere. Congressman, given how much we just heard from a Republican White House, I go to you as a Democratic member of Congress, your response to what we heard, and specifically these absolutely sober and tragic projections of lives to be lost ahead.
Thank you, Ari, for your question. It was a very sober presentation. And let me first start by saying I want President Trump to succeed in stopping the spread of this virus, because the lives of my elderly parents, of my family, of my constituents, and millions of Americans are at stake. And that's why we all have to work together. At the same time, it's clear that the 3 bipartisan laws we passed in Congress are not enough, because this crisis is not ending in a few weeks. This is going to be months to potentially over a year. We're going to have to do another law, another stimulus package, because people's behavior has already changed in trying to not get this virus. So our economy is going to continue to be affected even when government starts lifting its restrictions. And that's why we're working on a 4th round of stimulus right now.
Understood. Dr. Osterholm, take a listen to Dr. Fauci today, putting the grim numbers in context by underscoring why this is exactly the time not to let up. Take a listen.
We're going to continue to see things go up. We cannot be discouraged by that, because the mitigation is actually working. Now is the time, whenever you're having an effect, not to take your foot off the accelerator and on the brake, but to just press it down on the accelerator. And that's what I hope and I know that we can do over the next 30 days. Dr.
Osterholm?
Well, you know, I think we're playing this like we are declaring the winner after 1 inning of a 9-inning game, when in fact it's about the 9-inning game. This virus will continue to spread through the United States and, for that matter, around the rest of the world until probably more than half to 60% are infected, or we have a vaccine that can allow us to get protection that way. And so these early numbers are just that. They're the first inning. And I think the media, as well as the fact that in our federal government we don't have an intermediate or long-term plan to say, how are we going to get through this summer? How are we going to get through into the fall? We very well can expect more big peaks to occur in places like New York City, even after this one is so-called flattened. And so I'm very concerned about that, because that's where, in fact, the greatest mortality may occur is not in the next 60 days, but in the next 6 to 12 months. And I don't see us planning for that at all right now. And that, to me, is a key missing part of this lack of a national plan.
Dr. Wen, you see these numbers presented. There were charts. There was high and low end. Everyone understands what an estimate or projection means. But do you see the United States government, which has its reasons for trying to both warn and to some degree get people serious, but also they're not trying to put out a number that's double or triple the possibility? Do you see this new 83,000 death toll by August as a bit of a floor rather than a ceiling?
That's right. I think it is the most optimistic estimate that we can be presenting. And even that is extremely sobering. I agree, actually, with what Dr. Osterholm was saying, that we don't have a medium or long-term plan, or even the acknowledgement that we are here for the long haul. I mean, we need to be addressing the short-term urgent challenges, to be sure, and getting supplies to frontline workers, getting our hospital capacity up to par. We have to do that. But what comes next? What comes with the next outbreak? We are in mile 1 of a marathon, and we're not even prepared for the second mile, much less for what's ahead. And we really have to get testing up and running too, or else I don't know how much faith we can have in these numbers and what they're telling us now, much less what they might portend for the future.
Understood. Michael Steele, the president has been fact-checked and criticized by many experts, including, to be clear, medical and nonpartisan experts, for the statements he's made and the misinformation he's put out. At the same time, our job here is to follow what happens each day. And what happened just now, for folks who saw part of that briefing, and I'm going to play a brief clip, was, to some degree, however short-lived it may be, a different message and substance, arguably, from the president. Take a listen.
This is going to be a rough 2-week period. As a nation, we face a difficult few weeks as we approach that really important day when we're going to see things get better all of a sudden. And it's going to be like a burst of light. I really think and I hope our strength will be tested and our endurance will be tried. But America will answer with love and courage.
Michael, does that strike you as different? Does it matter?
A, it does matter. B, it is different only to the extent that it is scripted. Because then what you see after he comes off the paper is where it becomes unnerving again. So to the president's last point before we were able to come on, where he was talking about being hopeful, that statement is a hopeful statement. Do you know why? Because there's hope in being honest. So just tell me what we're up against, because once I know what I'm up against, then I can latch onto that hope. The president thinks by just saying, oh, we're all going to be back in church on Easter Sunday, or, this is all going to go away in a few months. And could you imagine, if it was really 2 million, we're just telling you it's going to be 100,000, that collectively we get hope from that, Ari. And that's not how hope works. Hope works from an honest place. When our leaders come to us and speak with us with honesty, as the president did in that little bit of that moment. But then it all becomes unnerved when he gets up there and he starts riffing and thinking, and telling us how he really feels about this stuff. And that's when the hope begins to dissipate into consternation, frustration, and all those other feelings that people have.
Yeah, frustration throughout the nation. I mean, Congressman Lieu, I want to play another piece of the president here to Michael's point, because these briefings are a grim daily presentation to the nation. And because of the presence of Dr. Fauci, Dr. Birx, and others, they always have some useful information. Because of on some nights, the president's contributions and others, they can turn into a much more freewheeling piece of politics or misinformation. The president today, for example, bringing up his views on impeachment, which really is not where anyone's head is at. So, Congressman Lieu, take a listen to the president here doing the negative side, which is when he gets into just defending the government rather than giving people the medical information they need.
The question is, what would have happened if we did nothing? Because there was a group that said, let's just write it out. Let's write it out. What would have happened? And that number comes in at 1.5 to 1.6 million people, up to 2.2 and even beyond. So that's 2.2 million people would have died if we did nothing. We just carried on our life. Now, I don't think that would have been possible because you would have had people dying all over the place. This would not have been a normal life. How many people have even seen anybody die? You would have seen people dying on airplanes. You would have been seeing people dying in hotel lobbies. You would have seen death all over.
Congressman?
Thank you, Ari. I had no idea what Donald Trump was talking about. No rational person will say do nothing. In fact, everybody else was saying do a lot more than you already are doing. And I do agree that the job of the president is to give hope, but it's not to give false hope. And what ended up happening is in the early stages of this crisis, the president kept saying things that were false and misleading, and it led a lot of people to go and not social distance. It led a lot of people to take actions they shouldn't have. And without testing, it allowed this virus to continue to spread across America. And now we have the most number of cases in the world. We have more people that died now from this virus than 9/11. And we can't just look at this and say, let's just keep giving people hope. We have to give them the truth. And one other thing I want to add is when you look at these press conferences, if you were watching MSNBC, today would not have been surprising. If you watch Fox News, today's press conference may have been surprising to you because networks like Fox just kept giving false information, misleading information to many Americans, and they really should have apologized for what they did.
Speak to, Congressman, the role of perception and information in this. Dr. Osterholm, that does seem different. In other words, if Americans want to hold vastly different views of the world, even counterfactual, There are a whole range of topics where that may not hurt anyone, at least in the short run. Here, to the congressman's point, there were people who very recently, 8 days ago, 12 days ago, were using their platforms to say, put the economy first or get back out there or minimizing. Doctor, how important is it that everyone in the world, really, however you get your information, get on the same page about the precautions we can take? And do you think that will make a difference over whether this is, for the U.S., 83,000 deaths or 100 or 200?
Well, again, I come back to the point we're in this for the long haul. This is not going to be a one-inning game. And so one of the challenges we're going to have is how do we keep people basically keeping the country running, and at the same time, as this virus begins to escalate again, just as we're beginning to see in Asia, how are we going to put the pedal to the metal again? What are we going to do? We can't just shelter in place for 18 or 20 months till we get a vaccine. That's part of a long-term plan, is every time we left up on the suppression, we're going to see more cases. And that's where, if you look at these models, I mean, I appreciate very much the expertise of the modelers who have brought this particular model to the attention of the American public, the group at the University of Washington, the group at Harvard, the group at Imperial College. I jokingly say, as many of my colleagues do, all models are wrong, but some provide you useful information. And I think that one of the things we're all realizing is here, we're going to have a plan that says, okay, we get through the next 6 weeks. Then what happens when we start to let back up so we can get some kind of economy going again that just gives us the basic essential services? We're going to see more cases again. And I think we're not counting on that. That's what's going to be really important.
Right, and that goes to the road ahead. Dr. Osterholm and Congressman Lieu joining us both on a very busy night for both of you. I appreciate it.